Hey.
Baby boomers are causing a nursing crash. It's called a shortage. The American Health Association reports that 37 million boomers will have more than one chronic illness in 2030. That means 1 in 4 people will have diabetes, 1 in 3 people will have obesity, and 1 in half will suffer from arthritis. RN job opportunities are at an all-time prime time. Baby boomers with chronic conditions are going to require more nurses. My name is Midge Clark. I am a registered nurse. I've been a nurse for 18 years. I've worked in 5 different specialties, OBGYN. I've been a director of health services for them. I was working for home health educator. I've been a telemetry nurse. I've been a pre and post-op nurse, and I've been a home health assessment nurse. I began with an associate degree and then just recently graduated with a bachelor's degree in nursing. Also, nurses can get a diploma in nursing through a nursing school, but those are the 3 different ways you can be a staff nurse or nurse. There's also advanced practice nurses, and that we're not talking much about that now. So Florence Nightingale was said to be the mother of all nursing. And she said in hospital number 1 rule is to do no harm to the sick. So Florence Nightingale worked in the 1800s with the basics of nursing, keeping a clean environment, and starting off with what we now have as a nursing career. I will address 3 questions during this talk about registered nurses. First of all, what does a nurse do? Second of all, why do we need more of them? And third, is God calling you to be a nurse? First, let's look at what does a nurse do. Nurses care for the sick. They care for them in the hospitals, at home, in the offices, in urgent care settings. They directly care for their bodies by vital signs, treatments, wound changes, IVs, medications. They also care for their emotional needs by holding a hand, being compassionate, encouraging them through their sickness. And they care for their spiritual needs as well. Assessment, planning, implementing, and evaluating. Those are the 4 cores of nursing. And all of them include the body, soul, and the spirit. The Journal of Christian Nurses notes to assess a patient can happen in a conversation by asking them how are they handling their current illness or sickness, and how are they handling their recovery. They also suggest that you use an acronym called FICA, Faith, Importance, Community, and Addressment. So you ask a patient, what is their faith? You ask them, how important is it? And you assess, is there a community involvement? Do they go to a church? Is there other people of like faith? And then you address whatever needs that you might be able to address. Nurses advocate. That's something else that they do. They advocate for the patients, what their current care needs are, what their future care needs are. Will they need home care when they leave the hospital? Will they need a feeding program? They also advocate for those patients that can't speak for themselves because they may be comatose or have a stroke where they can't move for themselves. Nurses educate patients. Jennifer Ward is a nurse that writes for the journals of nursing, believes that educating a patient prevents readmissions into the hospital, and it also increases the patient's quality of life by empowering them to know about their own disease process and to take charge of their own health. She suggests using multiple different educational tools like illustrations and pamphlets and books, colorful things that will make things memorable. Nurses do a very important job. They do what they do very well. But why do we need more of them? If we have nurses now, why do we need more? Well, like I started saying, in 2011, baby boomers began to turn 65. And by 2030, 1 in 5 will be 65 years old. And we heard the statistics of how they're going to have diabetes and obesity and arthritis. Who will care for them? Occupational Outlook Handbook demands for 526,800 more nurses by year 2022. That's a 19% increase from what we have right now. American Nurses Association has seen this drastic need, and they have negotiated with government agencies and structured new ways to create incentives for new students to become registered nurses. Incentives are nice, but what about God? What about God's calling on your life? What about His giftings for you? Being a nurse is a gift from God. That compassion that you feel, is that compassion a gift from God for you to become a nurse? Can God use you as a nurse and your compassion to reach the hearts of His people? God's very involved in the human life, and He needs nurses to meet people where they are, care for them, and show them His love. Mother Teresa was just that kind of person. She was not seen as a nurse initially, but felt the compassion of God on the Indian people. And that compassion rose in her, and she took care of the Indian people, giving them dignity in death. And she did that by nursing care, by cleaning them up, by addressing their wounds, by giving them decency and treating them honorably. That's what God wants from us. God can use nurses in other Christian avenues, like the Journal of Christian Nursing, writing for those journals. He could use it as conference speakers, as educators. There's also medical missions, where you go on short-term missionary trips and provide medical care for the missionary trips, for the patients that you dress there. There's also Mercy Ship is one of those. Compassion International is another one. There's medical missions where you just go and tend to people for 2 or 3 weeks at a time. There's also a different kind of nurse. It's called a nurse recruiter. It's kind of what I've been sounding like, I think, where a nurse recruiter can sit with a student and identify where she can fit in her nursing career. Where is God calling her? In conclusion, I began this talk about baby boomers and about the high population over 65 that's coming our way, and about Florence Nightingale and how she said not to do any harm. Well, not being there is causing harm. So I have to ask you, are you being called to be a registered nurse? Thank you.